Have you ever stopped to think about what happens when something as pure as healing gets tangled up with cold, hard cash? It's a really tricky relationship, full of tension. Today, we're going to pull back that curtain and see what's really going on.
And this is the question, isn't it? When you're seeking help for your body or for your mind, is the number one goal your well-being, or is it the bottom line? Getting your head around this difference can totally change how you see the entire healthcare system. So, let's start our deep dive somewhere the influence of money is often a little more out in the open: medicine. Here, the costs aren't just financial. You can literally see and feel them.
This slide nails it. Think about it. In medicine, things are pretty tangible. A broken bone, a skin rash, a virus, these are all problems you can see. And the fix, like a cast or some medication, is just as clear. Did the bone heal? Did the rash go away? That transparency makes it a lot harder for money to completely take over. But, as we're about to see, it definitely finds a way.
I mean, we've all heard the stories, right? Shady partnerships with big pharma or treatments that get dragged out just to make more money. Our source material points out this is a huge issue in aesthetic fields, where people's insecurities can really be taken advantage of. In those cases, patients might get pushed towards solutions that are way more profitable for the clinic than they are effective for the person.
Okay, so this brings us to a much, much murkier world. It's a huge contrast to the clear-cut nature of medicine. We're now stepping into the world of psychology, where the true costs and benefits, well, they feel like they're written in invisible ink.
You see, unlike that broken bone, something like anxiety or depression is totally invisible. And the treatment isn't a pill or a procedure. It's this incredibly sensitive, personal, and deep act of emotional connection and communication. So, how do you measure progress? It's really, really hard. And that ambiguity creates this perfect little space where money can quietly become the real goal of a session, and the patient might never even realize it.
So, how does a therapist even go down that path, from healing to just commerce? Well, it's a slippery slope, as you can see here. A therapist who's focused on profit might start by just packing their schedule, maximizing their client load. But that, of course, leads to less attention for each person. Pretty soon, they start forgetting important details about their patients' lives. And then you get to the final step. The actual person gets completely overshadowed by the sheer volume of cases, and the real act of healing gets swapped out for a simple business transaction.
And this gets to the heart of a much bigger, more philosophical problem that goes way beyond just medicine or psychology. What happens to any deeply human act when money and ego become the main reasons for doing it?
This quote from our source material just hits so hard. It really gets to the core of the issue. It's this powerful idea about a fundamental shift that happens inside a person. When profit is put on a pedestal, the focus turns inward. The ego they're talking about here is the professional's own need for success, for validation, for money, and that starts to become more important than anything else.
And this is the direct result. The very person you're supposed to be helping is just overshadowed by the needs of the professional's ego. That human connection, the entire reason for the interaction in the first place, just gets broken.
Our source gives this a name: the distracting factor. It's this dangerous idea that when profit is the main goal, it doesn't just exist alongside the human element, it actively puts it in danger. It tanks the quality of care and puts all this pressure on getting a return on investment, sometimes at any human cost.
So, is there a way out? Is this just the way it has to be? Well, the source proposes a pretty radical, really thought-provoking way to shift how we think about payment itself.
Okay, look at this. On the left, you've got the standard model. Payment is an obligation, a transaction. You get a service, you have to pay the bill. But now look at the proposed model on the right. Here, money is reframed as a gift. It's an act of appreciation. The whole feeling shifts from "I have to pay this" to "I want to reward this person for their help." The goal is for the person who received the care to actually feel the pleasure of giving that reward, not the heavy weight of a debt.
And that leaves us with this final, really powerful question to think about. How would our relationships change, and not just in therapy or medicine, but in any human-centered exchange, if we saw payment not as an obligation, but as a genuine, heartfelt reward? It's a profound thought, and it challenges the very foundation of how we value care and how we value each other.